right, welcome back. Welcome back to the channel, everybody. Thanks for coming back and checking out my second video. Today's video is going to be about an epidural and how an epidural is placed, what are the risks of an epidural, and what are the benefits. Now, before I get started, I just want to point out this is my second video. I'm still new at this, so if there are any errors, please forgive me. Also, as you can tell, you can see my shoes a little better in this clip, as well as some of my hats in the corner over there. And from time to time, I'll put them on and change it up a little bit so it doesn't look as if I'm lecturing, as opposed to just giving out information for everybody to kind of digest and use in your benefits. Today's video is going to be about epidurals. Hopefully, you find it informative. It kind of takes away some of the stress of surgery. More than likely, if you found this video, you found it because you're pregnant, about to have a baby, maybe your first baby, or you're going to a big surgery and you need to find out what an epidural is and why your physician is suggesting you get one. Now, let's start off with the basics. What is an epidural? An epidural is a catheter that is placed into your back, between your spinal bones and your spinal cord. It's in a place that we call the epidural space, where the catheter is placed. Now, this area usually is in the lower part of your back where there is not a spinal cord if this is for pregnancy and labor, but it is introduced and placed with a needle. Now, everybody fears the needle. Everybody talks about how painful it is, but if done properly with the proper positioning, it is a very scary procedure, but not as painful as people think it is. So let's talk about how it's placed. So an epidural is placed primarily through a needle injection with a needle that has a hollow interior. And when that needle gets to the position, which is in the epidural space, we thread a catheter through that needle and leave the catheter there. We take the needle out. Now that needle goes between your spinal bones. So we do numb that area up with some local anesthetic. And typically what you feel during the epidural after the first injection, which is usually the worst part, which kind of feels akin to a bee sting if you've had one before, or by the time you get an epidural, you will have an IV line, and it'll probably hurt less than the IV line. But that is to numb up your skin and the muscle and tissue in your back. And then once that local anesthetic kicks in, typically what you feel is weird twingy pressure in your back. Sometimes you can get a sharp pain. Rest assured, most of the time, or the majority of the time, that's not the needle coming in contact with a nerve. It's just that area is very sensitive because it is close to your spinal cord. But that being said, there always are risks that we'll talk about a little bit later. So back to the placement. So once that needle gets into that spot, we put a catheter in there, take the needle out, so there's no metal left in your back. It's just a plastic catheter that sits there, has holes at the end of the catheter, which then inject medicine, typically a combination of a local anesthetic and a narcotic that numb you up from your belly to your toes. And in the case of pregnancy, they numb you up all the way up to your upper belly. And that's to take away all the pressure there is during laboring process. Take away the pain there is during laboring process. Now, the pressure you will still feel throughout the entirety of the laboring process, and that is to ensure that A, that you know when to push when the time comes, and B, if we were to numb up the pressure as well, it would cause you to be numb. Your muscular muscles, your movement muscles, your pushing muscles would be numb, and once those get numb, you won't be able to push the baby out. So it's a combination of those two. You'll still kind of feel the pressure during labor, which is a bit uncomfortable, but the sharp pains that you have should go away. Typically that's what happens. So now going on to the risks associated with an epidural, there are a couple risks. So anytime we poke you with a needle, chance of infection, chance of injury to nerves, chance of medicine going places where they're not supposed to. What I mean by that is whenever you get poked with a needle anywhere, there's always a chance of infection because there is bacteria on your skin flora, and that can be introduced underneath your skin, which then can cause an infection. It's pretty rare, but it can happen. We typically clean off your back. The anesthesiologist will rub you with some sort of solution that would kill off most of the germs that are in your back. That being said, there's always a chance of infection. Injury to nerves is pretty rare, but it can happen. Where we typically place the epidural for labor is in your lower back, your lumbar region, below the point where the spinal cord ends. So there shouldn't be any sort of spinal cord there, but there can be anatomic variants. There can be people that have different anatomy. So there can be an injury, and that is theoretically possible. The third most common risks is medicine going places where it's not supposed to. What I mean by that is medicine can go into your bloodstream. It can go into your spinal fluid. These can have consequences, which can range from very small side effects to dangerous side effects. Now that being said, it's pretty rare. We take safety measures to prevent that, but they are risks and they are something you should be aware of because it is a procedure being done on your body. The benefits, though, most of the time outweigh the risks, and the benefits associated with an epidural include number one, your pain relief. But number two, it decreases kind of that sympathetic surge, so that pain that you're feeling causes your blood pressure to go up and causes you to tighten up, which causes more difficulty for the uterus to relax, and therefore the epidural does take away that tension. It does help progress labor most of the time, and it can also improve your vital signs. That being said, if you do have a low blood pressure, it can decrease your blood pressure as well because it takes away all that sympathetic painful surge that you're having from deep contraction. And when that happens, the blood pressure can get low, but don't fear, there is medicines that we have to kind of fix that. But it is a risk that can happen. The other benefit associated with having an epidural is that if you have to emergently go for a C-section, the epidural is in place that we can use to give you enough medication for the C-section itself. You do not need another poke in your back, which is typically advantageous for you, for the baby, and for everybody involved, because you can kind of rapidly dose it up instead of doing what we call as a spinal anesthetic. I'll talk about spinals later in a different video, but as far as this is concerned, as far as obstetrics and having babies is concerned, having an epidural is advantageous in that sense. So if you go for a C-section, it is usable for the surgery itself. So those are kind of the risks and the benefits. Now, when is it the best time to get an epidural? It's usually a combination of a decision between you, your provider, the midwife, or the obstetrician, and kind of a decision as to when the risks and benefits kind of line up. If you do get it too late in the process, it won't have the same sort of effect for pain relief, especially if you have a epidural that's placed moments before you give birth. It's very hard to get any sort of pain relief adequately. As far as early placement is possible, but people do say, and research does say, that it can increase your laboring time, which can lead to more C-sections. So it's kind of, you have to find a happy medium in between, and that is where you kind of decide where the pain is not tolerable enough and the nitrous oxide or the fentanyl is not working. That's probably typically the better time to get an epidural. Depending on if it's your first pregnancy, second pregnancy, third pregnancy, the time will vary because each subsequent pregnancy is faster baby delivery. So those are kind of the risks and the benefits and the placement of the epidural. I hope that kind of demystifies it a little bit for you. Now, the most important thing is when you get to the birthing room, when the anesthesiologist comes and talks to you, give them any sort of questions that you have, any concerns that you have, things you might have heard. You tend to hear different stories from different people. Just being in practice, you can find out some people have very imaginative stories about the placement, how much pain there is, and all those sorts of things. So make sure you ask any sort of questions that you have at that point, and let your anesthesiologist know about any sort of blood or bleeding disorders that you have, because those can be very, very important as to the placement of the epidural. Now, I hope you found that video interesting. It's kind of running long, so I'm going to end it here.